presentation I did my first presentation was in 2012 that I did this presentation in India, in New Delhi, and I did again in an acupuncture research conference there, and I will present it to you again today. Headache is a pain anywhere in the region of the head and neck, and approximately 50% of the population suffer from headaches during the year, and more than 90% report a lifetime history of headache. In traditional Chinese medicine, believes that headaches are due to external factors such as wind, cold, dampness, and heat. And internal injuries such as liver yang, hyperactivity, the flaming up of the liver, fire, qi, and our blood, and our kidney deficiency. Retention of phlegm, dampness, and blood stasis due to trauma. And the major important internal factors which cause headaches are those involving liver and gallbladder meridian in TCM. And treating the effect and after the cause is very common when one has a chronic interior disease with occasional aggravation, and when the patient has a headache due to the invasion of cold or hot wind, he should be treated expelling the exogenous pathogenic agent. Then tone that which is deficiency. If it's done in the same sessions, the condition could be aggravated, strengthening the exogenous pathogenic factors. But in most of cases, in the treatment of headaches where there is no invasion of the exogenous pathogenic factor, I treat the effect and the cause together in the same sessions. In this next slide, I will show the location of several types of headaches and what meridian is disturbed. And I will show what kind of food I usually recommend avoiding in each situation. In the next slide, I will explain which energy channels is disturbances according to the location of headaches. And headache in the forehead. Headache in the forehead, especially in the temples, are due to the disorders in the gallbladder or food showing. Let me see. Oh, this line. The pain in the back of the neck and head. Let me see. Oh, here. Here, when the headache is in front is the stomach or food yummy. Normally this headache is generated when the patient doesn't eat food for many hours. His stomach is empty. And the gallbladder meridian is when he had the pain in this part of the head. It is the gallbladder meridian. And the pain in the back of the head is the bladder channel. It's normally in this kind of region. And the liver channel, normally the headache is in the top of the head. And here are the treatment I usually do. I usually do the apex ear bloodletting to take out some heat retention that this patient could have, and treat and all kinds of pains. I usually do the apex ear bloodletting. And here are the points I usually do. I usually treat the anxiety points. Here the anxiety points. Here is the point to sleep well. And here is the liver and gallbladder and kidney. And here's the spleen, all to balance the yin yang, qi and blood. And here is the large intestine to take out the wastes in the large intestine. And here is the heart and lungs. And here are the symptomatic points to treat the headache when the patient has the symptoms. Is the vertex, temple, and forehead. Here's how I do the apex ear bloodletting. I usually put the gloves and put alcohol and clean with alcohol with a cotton ball. I bend the ear and prick the apex of the ear with an insulin syringe needle and squeeze the ear to take out 3 to 5 drops of blood. And here are the procedure that I usually put to treat the headaches. Here are the points to treat the headaches. Here is a research that I did in my clinic. I study 1,500 medical records, and in these records, 10% have a headache diagnosis. And from this, 48% of these patients were contacted by phone call, and 4.6% had headaches as primary symptoms that they reached the acupuncture clinic to try to treat the headache symptoms. These were the questionnaire the research do by the phone. He had headaches, was the main symptom, how many acupuncture sessions he did, how many sessions did you notice an improvement, how you do evaluate a solution for your headaches, if he needs some hospitalization or previous treatment with medication, would you recommend acupuncture treatment for headache, and did you feel you were completely cured or not? Here the result is the 94% show total improvement, and 63% improved in the first month of the treatment, and 30% only after the first month of the treatment. And the evaluation of this patient is that the auricular acupuncture were excellent for the treatment for headache. 94% said excellent, 4% said was regular, and 1% said that unsatisfactory. And these patients normally we orientate the patient to avoid some the food that could imbalance that meridians that I didn't show you, but to avoid the imbalance of the gallbladder and the liver meridian, we normally orientate the patient to avoid all dairy products, fried foods, eggs, chocolate, honey, coconut, and alcoholic beverages to don't imbalance the bladder meridian that is on the neck after behind the head. You need to avoid the coffee, soda, mate tea, and to avoid if the patient have some yin and yang deficiency, if the patient have some colder symptoms, if he feels colder, I usually orientate the patient to not drink cold water and avoid to eat raw food and raw fruits too. Only cook it or and eat especially dry fruits. And here is the necessity of hospitalization. For 85% said that they don't need hospitalization, but 14% need to be hospitalized due to headache. And in this patient, the more than half of the patients said that they did some neurological treatment prior going to the acupuncture treatment. And the majority of the patient would recommend the auricular acupuncture for the treatment of headache. And these 20% feel completely cured, but almost 60% said that they had significant improvement of the headache, and only 20% had said they doesn't have a cure of skin symptom. This group of patients are usually the ones who do not follow the dietary counseling, avoiding dairy products and all the foods that I told you. And that's why the results are not so good in this kind of patients. And the conclusion of this study is that auricular acupuncture is effective in the treatment of headaches based on the patient's evaluation and their recommendation of auricular acupuncture to others. And the vast majority felt improvement or cure, and more than half of